Hi, my name's Siva Kumar, and I'm a consultant plastic, cosmetic and reconstructive surgeon. Today I'm going to be talking about sentinel lymph node biopsy for melanoma. Melanoma is a type of skin cancer that we're very concerned about because it has the potential to spread. And one of the most effective ways of finding out if the melanoma has spread further away from where the mole was actually growing is to do a procedure known as a sentinel lymph node biopsy. What is a sentinel node and how do we do the procedure? The sentinel node is the first node that the lymphatic drainage drains into from the primary tumour. How do we find this out? Well, it's a staged procedure. So in the first stage, you'll go along to a nuclear medicine department and they inject a very small amount of radioactive dye into the area where the melanoma was. This is then traced into your lymph nodes. This could be in your neck, it could be under your arms, or it could be in your groin. A scan is then performed, which is then sent through to the operating surgeon. Then you go into the operating department, and here a separate dye is also injected into the primary tumour site. Then using the scan and a radioactive probe, which picks up the radioactivity in the sentinel nodes, we can actually identify the correct node or nodes. The procedure usually takes anywhere between 75 to 90 minutes to perform. As well as removing the lymph nodes, it's quite common to perform a wide local excision, where a wider area of the primary tumour site is removed, and it may need a reconstruction in the form of a skin graft or a local flap. The vast majority of this surgery is performed as day case, and you're home the same day. The results usually take about 2 to 3 weeks to come back. These are discussed in the MDT, and then any follow-up plans are then discussed with you. It might be that that's all the surgery you require, and then you need to go and have 5 years surveillance. Or it might be that if the nodes are positive, that you see an oncologist to consider further treatment. The most common risk factors for a sentinel node biopsy are common ones such as infection, bleeding, scarring, and wound healing problems, as well as general anesthetic risks. But more specific to removing a lymph node are reactions to some of the dyes that we use, or problems with the fact that the lymphatics haven't had a chance to recover. This may mean you get a collection of fluid known as seroma, where at the primary site of where the lymph node has been removed, or in very rare circumstances, you can get something known as lymphedema, which can cause swelling to your limbs. But these will all be discussed in far more detail during the consultation. In summary, a sentinel node biopsy is a really effective tool for staging melanoma. It can identify whether you're at high risk of the melanoma having spread further. It may be that the node is negative, in which case it gives you peace of mind that you can then carry on with things and just have normal routine surveillance.